Alright, so now we will discuss the blood supply to cerebrum. We already discussed the blood supply to cerebellum. Now it's turn to discuss how the blood arteries are coming in the brain and they're supplied to cerebrum.
Okay, so we will discuss the blood supply system. Internal carotid artery. So it's rising from aorta. As a common carotid artery comes up, divide into external and internal carotid artery. Internal carotid artery enters through carotid canal, okay? It enters and exits from foramen lacerum, okay? Foramen lacerum. And it enters into the structure called guarna sinus. Exit from the top. And always remember, all the major arteries, they form a circle of Willis, which we will discuss further in the next video. They are present in subacrinoid space. So these arteries will pierce through dura mater, acrinoid matter, and appears in subacrinoid space. So internal carotid artery enters through carotid canal, enters exit from foramen lacerum, enters the guarna sinus structure, exit from the top into subacrinoid space. Now, internal carotid artery will divide into two terminal branches. One that will move laterally will be middle cerebral artery. One that travels anteriorly, ACA, anterior cerebral artery. On the other side, same way. Internal carotid artery comes out from guarna sinus in the subacrinoid space, divides into two terminal branches, middle cerebral artery and anterior cerebral artery. So just remember, cerebellar and cerebral are two different arteries. So cerebellar works for cerebellum, cerebral are for cerebrum. Okay? So important structure just to see how they divide internal carotid artery, how it divides into two terminal branches. So it enters carotid canal, comes out of guarna sinus in subacrinoid space, divides. One branch goes laterally. So one goes laterally and one goes anteriorly. ACA, MCA is lateral. Again. And now what we have to focus on, the posterior communicating artery, which is rising from internal carotid artery. So there is a posterior communicating artery which is coming out and going posteriorly, backwards. Same here. Posterior communicating artery rise from internal carotid artery and moves backwards, okay? Now, I'll explain that later, where they're going and where they're connecting, okay? So, one more artery. No, these are two systems and they want to talk to each other. They want to communicate with each other. How will they communicate? With anterior communicating artery. Anterior communicating artery. So these two systems are communicating with each other through anterior communicating artery.
Okay, now we'll discuss the MCA division and the lobes which are receiving blood from MCA, middle cerebral arteries.
Okay, now we will discuss the MCA division or distribution in the cerebrum area. So cerebrum, this is all cerebrum. So internal carotid artery comes up in the subacrinoid space, divides into MCA, AC, and ACA. ACA goes anteriorly, and MCA, middle cerebral artery, goes laterally. So it travels through the lateral sulcus and comes out from the lateral side of your brain. Comes out of the lateral side of the brain. But when it's traveling through the lateral sulcus, so this is the medial part of the lateral sulcus. This is the lateral side of the lateral sulcus. So it's going. When it's going from traveling, coming out from the lateral side, it gives deep branches to the anterior part of the brain, or deep parts of the brain, which are also striate arteries, which are the small arteries going deep inside the brain and supplying blood to the basal ganglia or internal capsule or corpus stratum. These are getting blood from MCA artery. So when MCA artery comes up from the lateral side, this is the lateral side again, lateral view side of the brain, it provides blood, supplies blood to the lateral side of the all the lobes. So it provides the lateral side of the frontal lobe, lateral aspect of the parietal lobe, some part of the occipital lobe, and temporal lobe, lateral part of the temporal lobe. So it is covering most of the hemisphere right here, the lateral aspect of the hemisphere. So it comes out from the lateral sulcus, provide blood to the lateral side of the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Okay, so let's see how, with the color coordination, how it looks like. So again, this is the lateral view of your brain. So this is the temporal lobe. Okay, this all green area is covered by MCA, middle cerebral artery. So it's providing lateral part of the frontal lobe, parietal lobe, lateral part of the parietal lobe, occipital lobe, some part of the occipital lobe, but majority of the occipital lobe is provided by PCA. We will discuss that later, but some part is provided by MCA, and majority of the temporal lobe is provided by MCA artery. Now it is important to understand all the lobes and their function, because if there is the occlusion of MCA artery in, let's say, a parietal area, you should be able to understand and identify the symptoms. The parietal lobe is responsible for this, and frontal lobe is responsible for this area function. So if there's an occlusion, there's a brain tissue, the dead brain tissue, what will be the deficits? Okay, so again, lateral part of the frontal, parietal, a little bit of occipital and temporal lobe, and some of the internal anterior deep branches goes to the deep part of the brain. But you can. Okay, now we will discuss the anterior cerebral artery, ACA. Okay, so we know that internal carotid artery comes up into subacromial space and divides into two important terminal branches. One will be MCA, medial cerebral artery, and one is ACA, anterior cerebral artery, ACA. Okay, so what we know is that MCA goes laterally, and ACA go anteriorly, and we are discussing anterior cerebral artery, ACA. So what we know is that the ACA comes up, goes up straight, and then goes backwards posteriorly. Okay, and it provides blood to corpus callosum. This is a structure, so it's providing blood to corpus callosum and some of the anterior brain structures such as internal capsule and some part of the basal ganglia. So using these striate arteries, small arteries, they are providing blood to the interior part of the brain. So let's discuss the lobes. So anterior artery comes up, and you see the arteries going up like this. So the medial part of the frontal lobe and medial part of the parietal lobe. So ACA is providing blood to the medial part of the frontal lobe and medial part of the parietal lobe. But there's something very important. You see the arteries shooting up right here, and they shoot up and spill on the superior part of the brain. So they're coming up and they're turning towards the superior part. So this part is also covered by ACA. It is very important to know why this area is important to understand. Very important to understand why there's a ACA blood supply and what is the function of it. So medial part and superior part. Okay, and I'll show you with the color coordination that how. So this is the ACA comes up in the pink color. This is all distribution of ACA. So ACA is covering medial aspect of frontal lobe and parietal lobe, and spill some of the blood on the superior part. So this is the superior part of the brain right here. This is all covered by ACA. So medial and superior part of the frontal and parietal lobe. And it's important to understand. So first, I'm just going to give you a little bit in outline of the lobes again. So frontal lobe is responsible for motor cortex, okay? So prefrontal lobe is responsible for executive functioning, and Broca's area, which is speech production. So I'm just giving you in a nutshell a little bit introduction of the lobes again. Parietal lobe, again, is providing blood to the parietal lobe, is responsible for somatosensory cortex, okay, for the feeling, your sensory cortex, okay, and spatial processing, like orientation in the orientation of the self in 3-dimensional space and space around you, so, and touch and pain. So that's the part of the parietal lobe. So you must understand, if there's an occlusion of ACA artery, what will be the deficits, okay? So now you know medial and superior part of the frontal and parietal lobe is supplied by ACA.
Okay, just to understand that ACA, if there's occlusion of ACA, it won't affect the Broca's area. If there's occlusion of MCA, that will disrupt, or there will be a dysfunction of speech production, because the Broca's area is on the lateral side, but it's on the frontal lobe, but the lateral aspect of the frontal lobe. Now we will discuss the posterior cerebral artery.
Now we will discuss the distribution of posterior cerebral artery. So I'm just gonna put this artery here. So right here at the junction, the meat. Now this top artery from the basilar artery, right and left, this is posterior cerebral artery. Okay, they're coming out here, and they're going backwards, posterior, okay, posterior to the brain. So they're coming out and going backwards. So they came out from here and they go backwards, and they supply blood to the occipital lobe, okay? They supply blood to the occipital lobe. And now if I show you the lateral view, so this is a medial view, okay? This is a medial view, so you can see the distribution here of PCA, posterior cerebral artery. And if I show you the lateral view, and this is the back occipital lobe, and the inferior part of the temporal lobe is provided by PCA, okay? So, and also PCA also supply blood to thalamus and hypothalamus, okay? So let's show you with the color coordination. So again here, this is pons, medulla, right? So PCA right here. So PCA, this is PCA, it comes out and goes posteriorly backwards and supply, this is a medial view, supply blood to the occipital lobe, okay? This is a medial part of the occipital lobe, and this is the inferior view, right? Inferior part of the, so majority of the occipital lobe receive blood from the PCA, and some inferior part of the temporal lobe. So this is inferior part of the temporal lobe. So this is a lateral view. So you can see from here that this side is also receiving blood from PCA. So PCA is supplying blood to occipital lobe, temporal lobe, so covering all the inferior part, then in temporal occipital lobe, the inferior part of the occipital lobe. So let's go over all the lobes again, blood supply. So this is a lateral view again, lateral view of the brain. So this is some little bit superior part of the brain received blood from the ACA in pink color. So this is the green color is the middle cerebral artery, MCA, and the temporal, the inferior part of the temporal lobe and occipital lobe receive blood from PCA. So this is the lateral aspect of the brain, and now this is the medial aspect of the brain. You cannot see MCA blood supply here because that's more supplying interior structure or deep structure of the brain. So ACA supply blood to frontal, parietal lobe, the medial aspect, and the PCA supplied blood to the occipital lobe. This is the medial part of the occipital lobe.